You can unmute and mute if you would like to speak to me or something like that.
That I understand. Streaming live on Facebook.
So now it's available to everyone.
Okay. Now you're on.
Yeah.
Should I start speaking? Andrea, is it time for me to start? Okay. So, good evening, everybody. I am Dr. S.C. Sood. I am a plastic surgeon, and I have been working with small children from Smile Train now for a long, long time. I've been asked to introduce you to myself first. I did my MCH in plastic surgery, which is a postdoctoral degree, in 1990 from King George's Medical University, Lucknow. And ever since then, I came to Delhi, and I've been working with various hospitals in Delhi in various capacities. And right now, I work as senior consultant and head of Department of Plastic Surgery at Max Hospital, Shalimar Bagh, and at St. Thomas Hospital in Civil Lines. I have a lot of microvascular surgeries, reimplantations, revascularizations, cancer surgeries and stuff to my credit in my life. But as time passed, I got attracted to this problem of cleft lip and palate. And especially when my association with Smile Train started in the year 2008. And because of this association and because it gives me immense pleasure to treat these children who are suffering so grossly in their life and who are not taken care of properly at many places. So we have over these years done nearly 6,000 cleft surgeries, of which majority of them have been free and they've been for poor children. By Smile Train, I guess around 5,500 surgeries are actually have been absolutely free to the patient. And so people often ask, on one side you do cancer surgeries, which are such intricate and major surgical procedures, and on the other you want to do this children surgery in poor patient. What attracts you to this? Cleft surgery is the real kind of plastic surgery in the sense that this is what most of the plastic surgeons love to do. It's a life-changing surgery. It's a surgery which changes a person's total future. And we're working on very small children. And these children, when helped and when helped properly, the whole course of their life changes. And as a plastic surgeon, it brings you immense pleasure to look back at them and see how all the interventions you have done they have changed their life and they have changed their whole outcome. Cleft lip palate surgery in India has been, happening right from the beginning. In fact, in King George's Medical College, now university, since 1961. That's almost a year before I was born. But there's a lot of difference in the way cleft patients have been treated in this country in all these years, and the way they should be, and that is the basic issue or basic topic on which we're going to dwell today. That's the comprehensive care. So most of the cleft surgeries so far have been, like you come to me and I operate and stitches out 7 days and that's the end of the story. That is just a small part of the whole job. And the whole treatment is much more and much more than that. So let's first talk about what the whole problem is. Now, the face during development, when a baby is being formed in the womb, it basically forms from three different segments. The middle segment is the segment which forms the nose and the middle part of the lip. And then there are two segments on the sides, and all these three segments they unite and they give shape to the lip and to palate. Palate is what we call as the roof of the mouth, or the partition between the nose, nasal cavity, and the oral cavity. So that's the palate. Now, for some mysterious reason, we've not been able to understand. A lot of factors have been predicted. Some say there are nutritional deficiencies. There is some degree of inheritance. Around 2% of these children have parents or family members who also have cleft patients, but that's a small number. So, are there environmental factors? But nobody has been able to pinpoint for sure. And vast majority of these patients, they practically we cannot find out why they did have that cleft. So when a cleft happens, and if you're looking at this picture of this child, unfortunately this child has grown up without any support for cleft surgeries. He should have been operated very early. We do it at 3 months. Most of the surgeons will do it in any time between 3 to 6 months. So that would have been the right time to treat this child. So, but then this picture is to give you some idea what cleft look like. And this is a unilateral cleft, which means it's a cleft on one side. The kids who born with clefts on both sides, the situations are even more worse. And all these patients, they can have like varying degree of cleft. You can have a small area involved, you can have large, you can, as in this child, full of the area involved. And in this child, if you open his mouth and look inside, you'll find that the nose and oral cavity are connected. So the roof of the oral cavity, the roof of the mouth, also has a huge opening into the nose. So what are the problems? What happens to these children if they go untreated? What are the basic issues which are involved? There are numerous issues. When the child is born, the first issue is how to feed the child. Because the swallowing mechanism is deranged. Every time the child tries to swallow the food, the milk will go into the nose, and the whole of the area there, which is involved in the swallowing is deranged. So first issue is how to feed the child. And then the nutrition suffers. Most of these children are malnourished, underweight. And then as they grow up, there is gross facial disfigurement, chehra keeping at that. So, sky, it's not just the scar or the shape, the bones and everything is disturbed. The dentition is disturbed when they grow up and get not getting rid of it. So, and most importantly, speech. So speech has been one major area where in recent years, a lot of research has happened. And results have changed very drastically. So speech is important. And speech is such an important issue that, you meet patients who have been treated inadequately or who have been treated very late in their life and they have bad speech because of cleft palate. Their careers get ruined. They don't do well in education. They don't get jobs. Their life gets ruined. So speech is a very, very significant part of treatment of these patients. So speech gets hindered, and it's a complex defect. It involves skin, it involves muscles, it involves bones, it involves muscles which give expressions and shape to the face. It involves muscles which, as I said, are involved in speech. So that is the whole problem. And as I said, surgery is just a part of the treatment. You know, it's an important part, no doubt. You need to put things together and unite them and give them a good shape. But then it's just a small part of the treatment, and the whole effort, in fact, has to start nowadays, you know, with more and more uh, babies getting diagnosed even before they're born. So 20 weeks of pregnancy and ultrasound can tell in most of the children whether the child has a cleft lip or palate or not. Roughly 1 in 700 births will be a child which will have a cleft. So uh, the reason that's a huge number when it comes to a country like ours. It's a huge number, and it's the backlog was, in fact, when we started, the backlog was so huge that we get used to get patients who were 15, 20, 25 years unoperated. So it's a huge number, which the system itself, till organizations like Smile came, and they started contributing to management of these patients. There were a lot of patients in India, everywhere, which didn't get adequate treatment. And fortunately, now after all these years, we have less of older untreated patients, which have been seen thanks to Smile, which has done a wonderful work. I think what 6.5 million kids treated world over, and I guess 6.5 or 7 lakhs, something around that, kids treated in India free of cost. So coming back to what the actual problem is, that so we diagnose this child before the child is even born, and very often these children parents, they come to us and they talk to us about counseling. And the first thing is that yes, this child is going to need treatment. Yes, it's going to be a stage treatment. It's not like every day you're running to the hospital, but multiple interventions would be required. So that is important. Then we advise the would-be mother to take care of herself on nutrition, so that and stay in proper care of with a good gynecologist or obstetrician, so that we have a good healthy child to deal with. So when the child is born, our first role is to educate the mother how to take care of the child and how to feed the child, and especially how to breastfeed the child, because all the modern research has pointed that newborn babies who are breastfed do much better than bottle-fed children or formula-feed milk-fed children. So we encourage breastfeeding. Breastfeeding promotes bonding between the child and the mother. So that is the feeding part is the first thing we need to take care of. And fortunately, with little bit of an effort, most of these children they start taking feeds normally and they gain good weight. Second thing is now that's why we call it as a comprehensive treatment, because it's a teamwork now. And the teamwork also, it's now you have a nutritionist, you have an orthodontic surgeon, you have a speech pathologist, you have a plastic surgeon, you have a social worker, a counselor, a psychologist. So all these people join in. So right now, at the age of 2 weeks or so, we send this small baby to our orthodontist, who gives this baby treatment, which is a pre-surgical treatment. And in common language, it's called NAM, N-A-M. The full form is nasoalveolar molding. Now, this is a device which this orthodontist will give the child, which will fit into his or her mouth and gradually shape the area, shape the bone, bring the bones together, and shape the nose. So this treatment significantly improves the results of the surgery. The first surgery is for the lip, and this surgery normally is done minimum ages, like 3 months. Very rarely, very few surgeons might do it early. Many surgeons might do it late. So anything between 3 to 6 months is the time to do the lip surgery. And the palate surgery initially was being done at the age of 1 year, but now because nutrition is important, and so we try to do it early. And in our center, we do it at 7 months. We do lip at 3 months and palate at 7 months. And various surgeons will do it anything like 6 to 9 months or so. Some maybe even today would be doing it at 1 year. And the exact protocols might vary, from person to person and person to person. Then after the lip correction also involves the nasal correction, and the palate repair is done. The basic work is done, but it's just a beginning. At around 3 and 4 years of age, when child is old enough to sit and talk to you, understand what you're saying and follow your instructions, that's the time we evaluate speech. Roughly 5% of these children will still have speech issues. This percentage used to be 20% when we started working. So these new techniques bring it down to less than 5%. So these 5% children might require another surgical intervention for speech. And before that or after that, they will also require speech therapy with a speech pathologist who will train these children how to speak better. Then at around 8 or 9 years of age is the age where we start with dental treatment, where the orthodontist comes into picture again. And he'll align the teeth in the normal locations. And if there is an area in the cleft where there is a bony gap and a tooth is not being able to erupt in that area, then he'll send these patients back to us and we'll put some bone there and reconstruct that area so that dentition can be normal. Now, dentition is very important. It's very important because so very often, we do a lot of good surgical work and everything seems to be normal. But the moment the patient opens his or her mouth and smiles, that the other person gets to know that something is so grossly wrong with this person. And the best results are if it's done at 9 years of age or so, when the permanent dentition is there. So orthodontics, and then at the age of 16 or 17 years, we do final retouch procedures when the growth is complete. These procedures would normally mean a nose job or a jaw surgery or some cosmetic procedures on the lip. If a patient with a complete cleft with the maximum amount of deformity comes to us at the right age and follows the treatment as advised, at the age of 17 years, no one will be able to tell that this child has a cleft, was born deformed. The surgery is that effective. At the most, maybe there's some scar visible or a little bit of blemish here and there. But the surgical procedures these days are so good that there is no need for the child to, live with that stigma of being born with a cleft. And that is the aim of the surgery, and that's why we call these surgeries as life-changing procedures. Reminds me of a few stories I'd like to share with you today. I normally operate on Tuesday and Fridays, and smile trait cases or cleft cases. So on a Friday, I received a patient, very poor patient, a newly wedded couple, all right? Very conservative family, and then you could see the newly wedded girl having a big ghungat, and so it's difficult to even examine it. And they said that I've married her, but look, my wife doesn't look good. So can you do something for her? I said, fine. So I scheduled her for my Tuesday's OT, which means that she'll be getting admitted on Monday before the surgery. Monday, when she came to my OPD, my staff told me that this couple slept on the floor of the hospital for 2 days. They did not have the money to eat and sleep. They did not have money to go anywhere. They didn't have money to go back to Agra. Agra is not that far away from Delhi on Friday and come back on Monday. And I felt so bad, I said, you should have told me, I could have done something for them. But then they were so shy and hesitant, they just kept it to them. So we admitted this lady and we operated on her. Few months later, she comes to me and she says that she touches my feet, I don't know which, and asked for my blessing and said, fine, but how are you? She said that you don't know what was going to happen in my life. My mother-in-law had made my life hell. My husband wanted to divorce me. And within a week of my marriage, I was going to get thrown out of the house I got married into. And it's this surgery that saved my life. So I'm back. My husband is happy. My in-laws have now accepted me. And I'm happily back in my married life. So that's all because of thanks to you. What she should have said is that's all because of thanks to Smile Train, in fact, because it's without their help, we wouldn't have been able to do all this stuff. So that's how, it's a life-changing surgery. That's why we call these surgeries as life-saving surgeries. That's why as plastic surgeons, we feel, we do much more. Let's see, you go to a general surgeon, he removes your gallbladder stones and removes stitches within week 10 days, you find it, that's the end of the story. So one person has a disease, he cures it. We do something which makes a person a happier person and more well-settled person in his life. Reminds me of another young girl who didn't get good treatment when she was young, and she used to work as a hostess in a jewelry shop. She had 5 surgeries with me. 5 surgeries, because once you miss the train, if you don't get good treatment when you were young at the right age, then the treatment you're going to require, the effort you're going to require when you've grown up is also going to be more to put you back on track. So after 5 surgeries, this girl, she said that I'm going to sell my house, change the locality I live in, and take a new job. I'll resign from my job, I'll take a new job, because everyone where I live and everyone where I work know that I was born deformed. Now I don't look deformed. I want to live in a world where nobody knows what was in my past. So that's how people, the lives they changed. That's how. But then, as I said, for all these results to happen, all these miracles to happen, one needs a comprehensive cleft care. It's not just taking a patient to the theater and removing sutures and asking him or her to go back home. And it starts with educating parents, telling parents that this is all doable, this is all good, and this child not only is going to lead a normal life, is going to be the best son or daughter you're going to have. Because this child will appreciate what you will do for him or her as the child grows. So that's the story of the Smile Train. That's the story about Cleft lip and palate. If there are any questions, you're most more than welcome to ask. There's some questions which are already there. Can you show me those questions? Okay. The first question is, how can you tell a baby has a cleft lip? That's so obvious. Look at this picture. It's so obvious that the cleft lip is there. What is at times, missed is the cleft palate, because the cleft of the palate, it's inside the mouth, and it can happen in isolation without a cleft of the lip. And sometimes cleft of the palate is very subtle, what we call as submucous cleft, where the muscles have not united, but the skin or the mucosa, as you call it, inside the mouth has united. So, when you feed the child doesn't take the feeds adequately, and then you get to diagnose it. Unfortunately, as we know, in poverty and peripheral areas, there might not be enough facilities, for these children to be diagnosed. But that is the area where there can be some confusion, where you need a specialist to look inside the mouth and tell you. but lip is so obvious. Can a cleft lip heal itself in the womb? See, the first situation is the cleft lip. As I said, that there are three segments which fuse and they give shape to the lip, right? So there is a cleft lip as it is, and the cleft heals in all normal people. It fails to heal in these patients, and that's why they're born with cleft. So the situation is other way around. There are three segments which should fuse and they should give rise to a normal appearing lip, but they fail to fuse, so the cleft happens. So it's the other way around. What age should the cleft lip be repaired? Yeah, it needs some water. See, I think I've already answered that. See, at a younger age, the bones are so soft that when you do the treatment at the right time, the bones take normal shape and they grow normally. So 3 months is the time, and then the weight is also a consideration. At 3 months, normally 5 kgs of weight is what we expect the child to have. And should have a clear chest, no infections in the chest and throat, and the blood test should be normal. So all those are the criteria. 3 months is the age. And the rest of the protocol, I think I've already discussed. What happens to the palate if it's not treated? Now, these kids, they learn how to eat. So eating and nutrition catches up as they grow up, right? Speech is so severely impaired that, other than parents, very few people are able to understand what the child is saying. So their education suffers, their social life is zero, their productivity in life is severely hampered. So, reminds me of a chap who was 18 years and had complete lip and palate. And this is, I was talking with the backlog when I started. He was treated as the village idiot. He had no friends. People would tease him. He'll go to the fields, had his life alone. Nobody will talk to him. And when the social workers who work with us, they got hold of him, and the parents, they said, "Oh, there's nothing we can do about him. He's a gone case." And then I said, "Okay, you leave him with me and let me see what I can do." And then, 6 months, a year later, they realize, "Oh, fine, this is a normal boy. He can lead a normal life." So this is what happens if you don't treat lip and palate in time. What is the surgery for cleft palate? We repair it, right? And we repair the palate by tissues inside the mouth. And these days, more and more plastic surgeons are taking tissues from inside the cheek, from the back of the throat or from surrounding areas, and unite them and you create a new palate and you repair the muscles. So speech is normal. So this is, and I'm not going to go into technical details, a number of different kinds of surgeries and different surgeons prefer different techniques. So, but in general, that's how it's done. How many surgeries does it take to fix cleft lip and palate? Cleft palate, obviously, you need just one surgery. If there's a speech problem, which will be there in 5% children, you require another surgery. But let's talk about how many surgeries with these patients in general, with lip and palate have. A complete cleft lip and palate can have anything like, 4 to 6 or 8 surgeries in a lifetime. And bilateral cleft on both sides might even require 10, 11 surgeries, in their lifetime. That looks too many, but then all these are simple surgeries, and if done at the right age, the number comes down significantly. So I think I've answered all these questions. There are more questions here. Sir, my 2-year-old baby had bilateral cleft lip. You did the surgery to smile train 1 year back. She's okay, but her teeth are not arranged properly. Amit, nice to hear from you. So at 2 years of age, these teeth are not permanent teeth, right? They're going to fall off in coming years, and permanent teeth are going to come later. So we know these teeth are going to be deranged, and sometimes you have ectopic teeth. Ectopic teeth means teeth inside the mouth, away from where they should be. So you have all these problems, but then there's no point, pushing a small 2-year baby into a dental treatment for a result which is not going to last, few years time, because those teeth are going to fall down. So we don't do any orthodontic treatment for children at that age. When these teeth fall off and the permanent dentition comes, that is also going to be deranged. And that's a concern. And that's a concern. And roughly 8 or 9 years of age, when the permanent teeth they appear, the bone is soft at that time. And that's the time to work on these children, give orthodontics. And your child has a bilateral cleft lip, so she would require a good deal of orthodontics. So that is the time when these orthodontics also do things to improve the growth of the upper jaw, the appearance of the upper jaw. Those things also get into picture. So that is what should be there for the dental treatment is concerned. But then I'll be more concerned at this age about the speech. One thing important with the speech, and I think somebody in my team, I must have counseled you at some stage, is not to, teach the child how to speak at home, right? So many parents who are anxious, they get hold of those 3-year-old kids and no, don't speak it like this, speak it like this. So what you're doing is that you make the child confused, and you're enforcing the idea that the child is congenially malformed into the child's brain. And the child gets, okay, I am an abnormal person. Look, my parents, they asked me to do something I cannot do. So don't do that. Every good thing the child does should be a celebration, but there should be no harassment of the child. You should not pursue that. Let the child grow up normally as a happy child. Let the child play with other kids of his or her age, and bring the child to me at 3.5 years of age or so. If the child is not speaking properly, even if there is a minor speech defect, you should come, because all these things are treatable. So we are very happy with my baby girl. Bless you. Thanks for your wishes. And Smile Train and the mission. Thank you very much. All the best, Amit, for you and your daughter. That's all. How much time we've taken? Yeah, stop now. No more carry. Okay. So let's conclude. So cleft lip palate is a treatable condition, and the only thing is we need to be aware. When you listen to the whole story, it looks like it's a very cumbersome kind of a thing to do. It's not. It's not. There are a lot of things as parents you need to do for your children. You take them to school, you take them to college, you pay for their education, you pay for their tuition, and there's so many stuff in their life, for the excursions. So this is one additional responsibility which you'll have to take every few years. It's not that you're going to run to the hospital every other month or every day. So once every 3 months, another around 7, 8 months or 9 months, and then one look at 3.5, 4 years or 5 years of age, and then it's 9 years, and then it's just 15 years. So it's the only thing is you should be aware that everything has to be done at the right age, and that's when the results are best. And follow it up, and these kids will grow normally. And as I said, these kids are the best kids parents are going to have. They are so grateful that their parents have done so much for them that I tell them, my patients, जब बूढ़े हो जाओगे ना तो सबसे अच्छा यही ध्यान रखेगा तेरा ही बच्चा. So that's my concluding remark for the day. Okay.